Your gut is hosting trillions of microorganisms right now, not sitting passively in your intestines, but actively communicating with your immune system, synthesizing vitamins, producing neurotransmitters, and regulating the integrity of your intestinal barrier. That microbial community is digesting fiber into short-chain fatty acids that fuel your colon cells, training your immune cells to distinguish between harmless and harmful antigens, and sending signals through the vagus nerve that influence your mood, your appetite, and your stress response. This is happening continuously, whether you are aware of it or not. Your gut microbiome is not just assisting with digestion. It is functioning as a distributed organ system that influences nearly every aspect of your physiology. Gut dysbiosis, which is the disruption of this microbial balance, is one of the most under-recognized drivers of chronic disease in modern medicine. It does not announce itself with a clear diagnosis or a single defining symptom until the consequences have already spread beyond the digestive system. Usually in the form of autoimmune disease, metabolic dysfunction, or neurological disorders. The problem is that for decades we have been told that gut health is primarily about fiber intake and probiotic yogurt. Eat more vegetables, take a probiotic supplement, and your gut will be fine. Except that has not worked for millions of people. What we are now understanding is that the modern environment has created conditions that systematically destroy gut microbial diversity through mechanisms that have nothing to do with diet alone. And most people are experiencing gut failure without recognizing the warning signs their body is sending them. Hi, I am Dr. Alex. I am an emergency medicine doctor, and after nearly 10 years in AANDE, I have seen what happens when gut dysfunction goes unrecognized for years and manifests as serious systemic disease. And my goal now is to help people identify the early signs of gut failure and live longer, healthier lives. For the next several minutes, I am going to walk you through 9 signs that your gut health is failing. These are not just digestive symptoms like bloating or irregular bowel movements. These are systemic manifestations that indicate your gut barrier has been compromised, your microbiome has lost diversity, and the consequences are affecting your immune function, your metabolism, and your brain. And I just want to take a few seconds here to make you a promise. I promise to keep creating the most helpful videos I possibly can, grounded in science and the latest research to help you prevent the diseases I see in the emergency department every single day. And all I ask in return is that you give this fairly new channel a chance and hit the subscribe button. If you get to the end of this video and you did not think it was worth your time, or you have not learned something new, then feel free to unsubscribe. No hard feelings. But if you give me your time and your attention, I will give you everything I have learned from over a decade in medicine. So please help me out, hit the subscribe button to help this channel reach more people like you. And let's continue with the video. Before we discuss the 9 signs, we need to understand what gut failure actually means at a biological level. Your intestinal tract is lined with a single layer of epithelial cells held together by tight junction proteins. These tight junctions are supposed to regulate what passes from your gut lumen into your bloodstream. Nutrients get absorbed, large molecules, bacterial fragments, and undigested food particles stay contained. When your gut is healthy, this barrier is selective and intact, but when gut health fails, those tight junctions become compromised. The gaps between epithelial cells widen. This is called intestinal permeability or leaky gut. When your gut becomes permeable, bacteria lipopolysaccharides, which are inflammatory molecules from the outer membranes of gram-negative bacteria, cross into your bloodstream. So do partially digested food proteins. Your immune system recognizes these as foreign invaders and mounts an inflammatory response. That inflammation becomes systemic. It activates your immune cells throughout your body, not just in your gut. At the same time, the diversity of your gut microbiome is collapsing. In a healthy gut, you have hundreds of different bacterial species competing for resources and producing a wide range of metabolites. When that diversity is lost, often due to antibiotic exposure, processed food consumption, chronic stress, or lack of dietary fiber, a few dominant species take over. Those dominant species are typically less beneficial. They produce fewer short-chain fatty acids, which are the primary fuel source for your colon cells. They produce more inflammatory metabolites, and they are less effective at outcompeting pathogenic bacteria. The result is a gut environment that is both inflamed and dysfunctional, and that dysfunction produces effects far beyond the digestive system itself. Sign number 1 is chronic skin conditions that do not respond to topical treatments. Eczema, psoriasis, acne, and rosacea that persist despite using creams, ointments, and medications are often manifestations of gut inflammation. The skin and the gut are connected through what is called the gut-skin axis. When your gut barrier is compromised and bacterial endotoxins enter your bloodstream, they trigger systemic inflammation that affects your skin. Your skin tries to eliminate these inflammatory mediators, which causes the redness, itching, and lesions characteristic of inflammatory skin conditions. Research published in Gut Microbes found that people with eczema and psoriasis have significantly different gut microbiome compositions compared to healthy controls, with reduced diversity and increased populations of pro-inflammatory bacterial species. What makes this particularly important is that treating these skin conditions topically does not address the root cause. The inflammation is being driven from inside your gut, not from external factors on your skin surface. Sign number 2 is food sensitivities that seem to be expanding over time. You used to tolerate dairy without issue, but now it causes bloating and discomfort. Gluten never bothered you before, but now it triggers brain fog and fatigue. You are developing reactions to foods you have eaten your entire life. This is not psychological, it is immunological. When your gut barrier becomes permeable, partially digested food proteins cross into your bloodstream in forms that your immune system does not recognize as safe. Your immune cells produce antibodies against these proteins, creating delayed hypersensitivity reactions. Unlike true food allergies, which involve IgE antibodies and produce immediate food sensitivities involve IgE antibodies and produce delayed reactions that can occur hours or even days after eating the trigger food. Studies in the Journal of Allergy and Clinical Immunology have shown that people with increased intestinal permeability have significantly higher rates of food sensitivities compared to those with intact gut barriers. The expanding list of foods you can no longer tolerate is a sign that your gut barrier has been compromised for long enough that your immune system has developed reactivity to multiple food antigens. Sign number 3 is unexplained fatigue that does not improve with rest or sleep. You are getting adequate sleep, your thyroid function is normal, and you are not anemic, but you feel exhausted throughout the day. This is often caused by chronic low-grade inflammation driven by gut dysfunction. When bacterial lipopolysaccharides from your gut enter your bloodstream, they activate your immune cells to release pro-inflammatory cytokines like interleukin-6 and tumor necrosis factor alpha. These cytokines induce what is called sickness behavior, which is a constellation of symptoms that includes fatigue, reduced motivation, and social withdrawal. From an evolutionary perspective, sickness behavior is adaptive during acute infections because it conserves energy for immune function. But when it is triggered chronically by ongoing gut inflammation, it produces persistent fatigue that feels completely disproportionate to your actual activity level. Research in brain behavior immunity demonstrated that people with elevated levels of circulating lipopolysaccharides have significantly higher fatigue scores and reduced energy expenditure compared to those with lower level, independent of sleep quality, physical activity, or metabolic markers. Sign number 4 is mood disorders, particularly anxiety and depression, that develop without clear psychological triggers. The gut-brain axis is bidirectional, meaning your gut microbiome influences your brain chemistry and your brain influences your gut function. Your gut bacteria produce neurotransmitter precursors and neurotransmitters directly. Certain bacterial species produce gamma-aminobutyric acid, which is your brain's primary inhibitory neurotransmitter that reduces anxiety. Other species produce serotonin precursors, and approximately 90% of your body's serotonin is actually produced in your gut, not your brain. When your gut microbiome loses diversity and beneficial species decline, the production of these mood-regulating compounds decreases. At the same time, gut inflammation increases the production of kynurenine, which is a metabolite that can cross the blood-brain barrier and has been linked to depression and anxiety. Studies published in Molecular Psychiatry found that people with major depressive disorder have measurably different gut microbiome compositions compared to healthy controls, with reduced populations of bacteria that produce short-chain fatty acids and increased populations associated with inflammation. Antidepressant medications can be effective, but if the underlying gut dysfunction is not addressed, the neurochemical imbalance often persists or returns. Sign number 5 is frequent infections and prolonged recovery times. You are getting colds more often than you used to. When you do get sick, it takes longer to recover. You feel like your immune system is not functioning properly. That is because approximately 70% of your immune system resides in your gut-associated lymphoid tissue. Your gut microbiome trains your immune cells to respond appropriately to threats. Beneficial bacteria stimulate the maturation of T cells and B cells and help calibrate the balance between immune activation and immune tolerance. When your gut microbiome is disrupted, that immune training becomes impaired. Your immune system becomes both overreactive, which causes autoimmunity and allergies, and underreactive, which causes increased susceptibility to infections. Research in cell host and microbes showed that mice with depleted gut microbiomes had significantly reduced antibody responses to viral infections and took longer to clear pathogens compared to mice with intact microbiomes. The frequent infections you are experiencing are not just bad luck. They are a manifestation of impaired immune function that originates in your gut. Sign number 6 is brain fog and difficulty concentrating that fluctuates with meals or digestive symptoms. You feel mentally sharp in the morning, but develop cognitive cloudiness after eating certain foods. Your concentration worsens when your digestion is off. This is caused by the inflammatory mediators and bacterial metabolites that cross from your gut into your bloodstream and affect brain function. When your gut barrier is compromised, substances that should remain in your intestines gain access to your circulation. Some of these substances can cross the blood-brain barrier and directly interfere with neurotransmitter signaling. Lipopolysaccharides, for example, activate microglia, which are the immune cells in your brain, causing neuroinflammation that impairs cognitive function. Studies in Frontiers in Behavioral Neuroscience have demonstrated that people with increased intestinal permeability perform significantly worse on tests of working memory, attention, and processing speed compared to those with intact gut barriers. The cognitive symptoms are not imaginary. They are neurological consequences of gut dysfunction. Sign number 7 is autoimmune symptoms or a formal autoimmune diagnosis. Rheumatoid arthritis, Hashimoto's thyroiditis, inflammatory bowel disease, multiple sclerosis, and other autoimmune conditions are all strongly associated with gut dysbiosis and intestinal permeability. The mechanism is called molecular mimicry. When bacterial proteins or food proteins cross your compromised gut barrier, your immune system produces antibodies against them. Some of these foreign proteins have amino acid sequences that are structurally similar to proteins in your own tissues. The antibodies your immune system creates to attack the foreign proteins also attack your own tissues, because they cannot distinguish between the two. This is how gut dysfunction can trigger autoimmune disease. Research in autoimmunity reviews found that nearly all autoimmune conditions are associated with increased intestinal permeability, and in many cases, restoring gut barrier integrity can reduce disease activity and autoantibody levels. The autoimmune process is not solely genetic. Environmental factors, particularly gut health, play a critical role in whether autoimmune disease develops and how aggressively it progresses. Sign number 8 is unexplained weight gain or inability to lose weight despite caloric restriction. You are eating less, exercising more, and the scale is not moving. This is often caused by gut microbiome changes that alter how efficiently you extract calories from food and how your body stores fat. Certain bacterial species are more efficient at breaking down dietary fiber and extracting energy from food that human enzymes cannot digest. When your gut microbiome shifts toward these more efficient species, you absorb more calories from the same amount of food. Additionally, gut dysbiosis promotes insulin resistance by increasing circulating lipopolysaccharides, which interfere with insulin signaling. Insulin resistance makes it extremely difficult to lose fat because insulin is the hormone that controls whether your body burns fat or stores it. Studies in Nature have shown that obese individuals have different gut microbiome compositions compared to lean individuals. And transplanting gut bacteria from obese donors into germ-free mice causes those mice to gain more weight than mice receiving bacteria from lean donors, even when both groups eat identical diets. Your gut microbiome is actively influencing your metabolism in ways that make weight loss physiologically difficult, not just a matter of willpower. Sign number 9 is chronic joint pain and stiffness that is not explained by injury or arthritis. Your joints hurt, particularly in the morning or after periods of rest. The pain improves with movement, but returns when you stop. This is caused by systemic inflammation originating in your gut. When bacterial endotoxins cross your intestinal barrier, they trigger the release of inflammatory cytokines that circulate throughout your body and accumulate in joint tissues. Those cytokines activate immune cells in the synovial fluid, which is the lubricating fluid inside your joints, causing localized inflammation, swelling, and pain. Over time, chronic joint inflammation can lead to cartilage degradation and structural damage. Research in rheumatology found that people with inflammatory joint pain have significantly higher levels of circulating lipopolysaccharides and altered gut microbiome compositions compared to people without joint pain. Treating the joint pain with anti-inflammatory medications provides temporary relief, but it does not address the ongoing gut dysfunction that is generating the inflammation in the first place. Now, here is what most people do not understand. These 9 signs are not separate, unrelated problems. They are all manifestations of the same underlying issue, which is gut barrier dysfunction and microbiome dysbiosis. By the time you are experiencing multiple of these signs simultaneously, your gut has likely been in a state of progressive failure for months or years. The skin problems, the food sensitivities, the fatigue, the mood changes, the infections, the brain fog, the autoimmune symptoms, the weight gain, and the joint pain are all downstream consequences of the same gut pathology. This is why addressing each symptom individually with separate medications rarely produces lasting improvement. The root cause is not in your skin, your joints, your brain, or your immune system. It is in your gut. So what actually restores gut health? 3 primary mechanisms. First, you need to rebuild microbial diversity by consuming a wide variety of plant fibers that feed beneficial bacteria. Different bacterial species ferment different types of fiber, so dietary diversity directly translates to microbial diversity. Aim for at least 30 different plant foods per week, including vegetables, fruits, legumes, nuts, seeds, and whole grains. Studies have shown that people who consume more than 30 different plant foods per week have significantly more diverse gut microbiomes and lower levels of inflammatory markers compared to those who consume fewer than 10. Second, you need to repair your gut barrier by removing foods and substances that increase intestinal permeability. This includes processed foods with emulsifiers like carboxymethylcellulose and polysorbate 80, which directly damage tight junction proteins. It includes reducing alcohol intake, which increases gut permeability within hours of consumption. And it includes managing stress, which activates the hypothalamic pituitary adrenal axis and increases gut permeability through corticotropin-releasing hormone. Third, you need to support the growth of beneficial bacteria by consuming fermented foods that contain live microorganisms. Yogurt, kefir, sauerkraut, kimchi, and other traditionally fermented foods introduce beneficial bacteria and provide metabolites that support gut barrier function. Research in Cell has demonstrated that people who consume fermented foods daily for 10 weeks have measurable increases in microbiome diversity and decreases in inflammatory markers compared to those who do not. In emergency medicine, we rarely see patients coming in with gut dysbiosis as their presenting complaint, but we see the consequences constantly. Unexplained sepsis that traces back to bacterial translocation across a permeable gut barrier. Severe autoimmune flares that correlate with recent antibiotic use. Metabolic crises in patients with long-standing digestive issues. What becomes clear when you work on the front line is that gut health is not a peripheral concern. It is foundational to nearly every aspect of human physiology. The patients who maintain good health as they age are not the ones taking the most supplements or following the most restrictive diets. They are the ones who have preserved their gut microbial diversity and maintained the integrity of their intestinal barrier. So where does this leave you? The 9 signs we have discussed are not definitive diagnostic criteria for a specific disease. They are indicators that your gut barrier has been compromised and your microbiome has lost the diversity and function it needs to support your health. If you are experiencing multiple of these signs, it does not mean you have irreversible damage. It means you need to take concrete steps to restore gut barrier integrity and rebuild microbial diversity before the dysfunction progresses to formal disease. That may require working with a healthcare provider who understands the gut-immune-brain axis, eliminating foods that increase intestinal permeability, and making sustained changes to your diet and lifestyle that support microbial health. The goal is not perfection. The goal is creating conditions where your gut can repair itself and where beneficial bacteria can re-establish the ecological balance that modern life has disrupted. And finally, please subscribe to the channel if you found this useful to help me reach more people like you.